Well, welcome back, everyone. Today we have Dr. Pamela Gardner from the Lima Memorial Heart and Vascular Institute with us to discuss the importance of addressing women's heart concerns promptly with same-day heart appointments at Lima Memorial Health System. So thanks so much for joining us, Doctor.
Good morning, and thank you for letting me talk about something that's very near and dear to my heart.
Oh, definitely. My pleasure. Well, firstly, why is it critical to address heart concerns in women as soon as possible?
Well, if we ignore a heart problem and don't attend to it before the person actually has damage, the rest of their life can be spent having heart failure, unable to do any of the things that they enjoy, spend time with their family. So it's super important to, if you're having something that could be a heart problem, attend to it right away, check it out, and fix it if at all possible.
Right. So what specific symptoms or medical needs should prompt women to seek a same-day appointment for heart concerns?
Most women will have symptoms typical of what we think of: the chest heavy, pressure tight, burning, neck or jaw discomfort, and shortness of breath. But it doesn't have to be that. We girls, the book isn't written about us. We could have things like, I'm vacuuming and I kind of hit the wall and I have to stop and rest. I give it a couple minutes, I can go again. No chest discomfort necessarily, but something is up. We tend to be the caregivers and tend to ignore our symptoms. So we need to be paying attention. We start having things like palpitations, short of breath, chest, could be chest heavy, pressure, even burning. You think it might be heartburn, but it only comes on when you're doing something, goes away when you stop. That's suspicious, and that needs to be investigated.
Right. So can you tell us a little bit more about, like, maybe how same-day appointments work?
So what happens is you're having these types of symptoms and you're like, something's not right here. Then you call the office and we set up an appointment. We get you in, you see the physician's assistant who teases out some of your symptoms and helps you put together what's going on. And then you see one of the cardiologists. I want to put in a caveat to that. If you're having active symptoms, you're currently having chest pain, shortness of breath, it's breaking out in the sweat, etc., you need to be in the emergency room, not in the office. That's potentially an active heart attack. And the first thing I'm going to do is send you to the emergency room. So make sure that we separate out the two. Something going on right this second and acute needs to be there. But if it's happening off and on and something's up, I want to see you so we can start the testing before there's an issue.
Right. So now, if patients would need specific follow-up treatments and procedures after their appointment, how quickly are you able to get them in for the care that they need?
Usually the testing can be done the same week, and then back within a week to go over the results. If someone, for instance, has a stress test and it's abnormal, we will literally call you and get the next procedure, usually a heart catheterization, set up right then. These things, we don't wait. We're not going to have you have a test done and then a couple months later say, oh, by the way, that wasn't normal and now we need to do this. We literally will call you and explain what needs to happen and get you in to have the next level of testing done.
Right, and the heart health is so important, and we do have the number that's going to be shown on the screen here in just a second, and that's for anybody that wants to call for a same-day cardiology appointment. And like you said, if you're are experiencing symptoms of a heart attack, always call 911 and just go right to the emergency room. So, Doctor, I want to thank you so much for joining us today. I really appreciate it.
My pleasure. Thank you.
All right, well, don't go away because we have more when we return.